I just got done with one of my group coaching sessions, and there was a question brought up about vitamin K2 and vitamin D. Yes, you should absolutely take K2 if you're taking vitamin D. And here's all the reasons why. The K2 doesn't help absorb vitamin D. To absorb vitamin D, you need plenty of zinc, magnesium, and you need enough copper in your body to help your body absorb it. Not only that, though, you need these specific proteins in the intestinal membrane to be able to absorb a vitamin D supplement. These proteins are called peptides. You also need an appropriate level of cholesterol and fats, and your vitamin D should be taken with your fattiest meal of the day. So why the K2? The K2 is needed because it prevents vitamin D from actually leaching calcium out of the bones, and it helps the body actually deposit calcium into the bones where it's needed. If you take high doses of vitamin D and you don't take K2, you're going to end up with hypercalcemia, which can lead to kidney disease, vertigo, dizziness, unsteadiness, weakness in your legs, heart disease, a heart attack, and calcification of the nerves that lead to the eye, which could then result in blindness. This is another one of those situations where there's somebody on here who's a functional medicine provider saying, stop taking your K2 if you're taking vitamin D, you don't need it. You do. Please investigate why you might need something before you listen to someone on this app who's spouting supposed health advice. Like I said in the video I posted earlier this week, there's a functional medicine provider with MD after their name who had one of my clients on 59 different supplements. 59. Whenever you're getting ready to start any regimen, medication, supplements, whatever, it's really important to understand the physiology going on within you before you do that. It's really important to have somebody who knows about the physiological changes that could occur with taking a new supplement. And it's kind of funny, the client that asked the question, because she saw the video on this app, was like, I'm not asking because I don't believe you, I'm asking because I feel like I'll get a better answer from you. I wasn't mad at her. I am frustrated by the amount of bad advice given to people by people who I know are trying to help. They're honestly in it to help people, but they're not always aware of all of the physiological effects when they tell someone to do something. So to absorb vitamin D, you don't need K2, but you do need to take it to prevent you from developing too much calcium in the blood. You need magnesium, zinc, a little bit of copper, and fats, as well as these intestinal proteins that are peptides in the lining of the gut. If you started taking vitamin D and it doesn't have K2 in it, when you're not taking a separate K2 supplement, and you're experiencing dizziness, increased hip pain, foot and ankle pain, knee pain, or pain along your spine, and it's a new symptom, I would recommend backing off your vitamin D for a little bit, taking the K2 for a week, and then adding the vitamin D back with the K2 at the same time.